Welcome to Living Healthy Chicago. I'm Jane Klaus. We're kicking off today's show talking about concussions. We all know what they are, right? But do you know how to recognize when someone needs help? Let's find out more from an expert and hear her tips on recovery as well. Joining me today is Dr. Elizabeth Pieroth from Rush University Medical Center. Now, Dr. Pieroth, a lot of us know what a concussion is, or maybe we have experienced one. But what is exactly happening when a concussion has occurred in the brain?
A concussion is a traumatic brain injury that occurs when someone is either struck directly in the head or they're hit in the body and that moves the head forcefully. There can be a number of symptoms experienced after a concussion, but what we look for is evidence of what we call mental status changes. So that's confusion, disorientation, memory loss.
So what are the signs and symptoms to watch for to indicate that somebody may be having a concussion?
We want to distinguish between signs and symptoms. So signs are those things that are observable by others. Those are things like the person looks confused. They're acting strangely. They're slow to respond. They're walking and they may be off balance, that you're starting to see that something is not right with them. Symptoms are those things that are reported by the individual themselves. So they may say they have a headache, they feel dizzy, nauseous, they're seeing things double.
How do we know that we've had that injury? How hard does our head have to be hit, whether it's in a car crash or a sports game, or maybe just, falling and hitting your head?
That's $1 million question, because there's actually been a lot of research looking at what we call thresholds of contact, and it's very individual. So studies have looked at people who are playing sports and they put accelerometers in their helmets. Some people can have a very high G force and not have a concussion, while other people can have a lower G force and actually suffer a concussion. So we don't have a threshold.
When should somebody seek help, and why is it important to seek help rather than just walk it off?
Well, nobody has a tough brain. So we always encourage people to remove themselves from a game, remove an athlete from a game, remove yourself from a dangerous situation if a concussion is suspected. There are also what we call danger signs that suggest someone should go to the hospital. And those are things like repetitive vomiting, evidence of a seizure, headaches that are getting worse, confusion that is getting worse, things like a dilated pupil, which again are rare. But those are symptoms that should suggested that someone should immediately go to the emergency room.
So we know it's important to seek medical treatment, but what kind of advice can you give us about taking care of ourselves once we go home?
So once someone's been diagnosed with a concussion, what we really want them to do for the first 1 to 2 days is take it easy. I tell my patients to dial it back. You don't need to lay in a dark room, and you don't need to avoid all stimulation. That's really not based in science. Listen to your body. But if you're starting to feel more symptoms, then take a break. After the first couple of days, the research tells us that we want to start moving people back to their normal activity. But we want to start to encourage what we call symptom-tolerated activity. Most people can go back to work and go back to school within a day or two. Some people even the next day. As far as activity, there's been a real explosion in research in the last couple of years telling us that actually the sooner we move people, the sooner they get better. If it's increasing your symptoms, you dial it back. If it feels okay, we start to increase that activity.
So if you like this video and want more living healthy, just subscribe to our channel.